My name is Jay Nixon, and I'm a clinician with the Developmental Disabilities Service of the Northeast Mental Health Centre here in Canada, in Northern Ontario specifically. The study is about people who are in trouble with the law for what is regarded as sexually offending behavior, but is behavior that we believe, once better understood, is not actually sexually offending behavior, but what is more commonly or more accurately known as counterfeit deviance, from the work of David Hingsberger and Dorothy Griffiths. Counterfeit deviance is essentially behavior that looks like sexually offending behavior, but when it's better understood, is more a reflection of behavior that occurs in the context of a misunderstanding, a lack of knowledge, or a lack of opportunity for appropriate sexual expression. The plan is developed in concert with the Crown Attorney, and it essentially lays out a number of conditions that the person needs to meet for a period of time, normally 6 to 12 months. It will include things like sex education, it might include anger management, it might include things like impulse control, and it also would include specific conditions for care providers to keep the person out of trouble, basically, from reoffending. And once they complete that plan, then the record is essentially destroyed. They don't have a criminal record. Our study is in the context of the criminal justice system, and it's essentially a reflection of 6 case studies. And in concert with the criminal justice system, we've found that once people are educated, not only the individuals themselves, but their care providers, the justice system themselves, the courts, the police, and so forth, that we are able to have folks stay out of the criminal justice system or minimize their involvement with the criminal justice system. There are a lot of criminal justice systems all over the world that are very black and white about how they deal with these kinds of offenses. And I think the goal is to get the word out that there's a different way of doing this. That if we take the time to understand the purpose of the behavior and the genesis of the behavior, the origin of the behavior, we can certainly do a lot better for these folks. The one thing that we need to remember is that these people are individuals, that this is certainly it's not a panacea, it's not a cure for anything, but it is this is just the beginning of a way to identify and differentiate between true sex offenders and those who are engaged in what is known as counterfeit deviance. You have to look at each person individually.
Thank you.
Thank you.